Welcome doctors. Today, we're diving into an issue that all of us encounter in hospitals and clinics: prior authorization backlogs. Prior authorization is designed to ensure treatments and medications are both necessary and cost-effective. But when the process slows down, it doesn't just create paperwork headaches, it delays treatment, impacts patient outcomes, and adds unnecessary pressure to your staff and workflow. So let's break this down together. First, let's understand the prior authorization process. Before certain treatments, procedures, or medications can be given, approval is needed from the insurer. It sounds simple, but in reality it often turns into a maze of forms, documentation, and back-and-forth communication. And when there are multiple approvals needed, varying requirements between insurers, and slow response times, delays become inevitable. Now, why do these backlogs happen in the first place? A few reasons stand out. One is the increased volume of requests. With more treatments requiring authorization than ever before, insurers are overwhelmed, and hospitals are too. Another is the lack of standardization. Every payer has its own forms, processes, and timelines, which forces your teams to adapt again and again. Hospitals don't always have enough administrative staff dedicated to prior authorizations, and that leads to bottlenecks. Manual processes and fragmented IT systems make it almost impossible to efficiently track requests, leading to errors and missed follow-ups. But the real concern here is the impact on patient care. When prior authorizations get stuck, patients experience delayed diagnoses, delayed treatments, and sometimes even avoidable complications. You've probably seen patients waiting anxiously while you and your staff spend hours on phone calls and faxes instead of providing care. These delays don't just increase patient stress, they increase yours too. And when conditions worsen due to delays, the costs of care go up, stretching already limited hospital resources even further. So what can hospitals do to reduce these treatment delays? There are a few effective strategies that really make a difference. First, invest in automation and technology. Automated PA platforms, EHR integration, and robotic process automation can take on repetitive tasks by working closely with insurers, clarifying requirements, and using common forms across carriers. Hospitals can cut down on confusion and reduce the back and forth. Third, dedicate resources to prior authorization. Having trained staff or even entire teams focused solely on PA requests ensures that submissions are handled quickly and correctly. And finally, improve communication with payers. Real-time updates, and even negotiating pre-authorization requirements for certain procedures can prevent bottlenecks before they even start. So, what's the big takeaway? Prior authorization backlogs are a real barrier to timely care, but they don't have to be. By combining automation, standardization, dedicated resources, and stronger payer collaboration, hospitals can ease the burden, reduce delays, and give patients the care they need, when they need it. Thank you, doctors, for the work you do every day. Tackling PA backlogs isn't just about efficiency, it's about protecting patient health, reducing unnecessary costs, and creating a smoother system for everyone involved.